Murang'a County Government, under the able leadership of Governor Mwangi wa Iria, has been on the front line in various positive aspects of development, agriculture, and most recently, leading in the fight against spread of COVID-19. Immediately the pandemic entered the country and started spreading like bushfire, Murang'a Governor Mwangi wa Iria moved swiftly and made the announcement to construct an ultra-modern intensive care unit in 21 days.
As a county, we've started making a modern, new ICU unit, which we should be able to handle about 35 patients at a go. We are going to construct this, and we started 2 days ago, and we have said it's an emergency business. We are going to spend only 21 days.
Wa Iria's announcement came after the realization that there was no single ICU bed in the level 5 hospital that has been in existence since colonial times. Digging the foundation of the ultra-modern ICU kicked off with the locals benefiting on casual jobs.
Hii site saa hii iko na vijana karibu 60 wenye wanafanya kazi. Ndio hii ni project kubwa, hata kama wana keep distance. Kama saa hii mtu akipata pesa ni kununua unga na vitu za nyumba na kusaidia familia yake.
It was a 24-hour assignment.
Mimi washa gari huko Murang'a. Saizi hakuna gari zaenda Nairobi, hakuna gari za tembea, zote zililala. Sasa saizi watu wale tuko nao huku wakao ni karibu 40. Saizi tunafanya kazi ya kutengeneza hospitali ya ICU.
Hii kazi nafanya usiku na mchana. Juu naonaga inanisaidia. Juu ukipata kama ni hiyo 500 napekwa hapa, nikiongeza ingine hiyo usiku, hiyo pesa itakakaa, nitakuwa sina shida kubwa sana ya sakura ama kununua kitu ingine, hata kununua nguo.
Construction materials were sourced locally at labor-based contract that helped in cutting down the cost of putting up the ultra-modern intensive care unit. Mwangi wa Iria said that the contract basis is usually very expensive and mostly benefits contractors and not the locals.
We are not doing any contract, we are doing a labor-based program, whereby we are going to spend nearly a quarter of what we would have spent if we would have gone on tender. We are using our own engineers as supervisors instead of having a tenderer doing the same.
The construction work began under strict supervision of the county government's chief executive officer, engineer Amos Njoroge, who ensured that even with the shortest time frame given for the construction works, standard measures were observed.
We have not even skipped one step in terms of engineering. We did the usual setting out, doing the foundation setup, doing foundation structure, the superstructure, and as well in the roofing. And we have been using actually the latest technologies to ensure that we actually meet the target. We have been using some of the additives like Rapid 2 to ensure that we fasten our hardening and curing and gaining the strength of the building.
Seconds clicked, minutes counted, and days went by. A lot of people streamed in to witness whether the construction works would really take the Murang'a governor's projected 21 days, with many raising questions whether Kenya has the capacity to do so after China's Huashinchan hospital that was constructed in 10 days.
Mbele nilikuwa nafanya kazi ya catering, lakini sasa hii makazi yamefungwa. Ndio maana nikaja kuuliza kazi kwa Mwangi, nikapata hii kazi ya kujenga. Nashukuru sana juu by the end of the day napata kitu ya kupelekea mtoto. Na pia hii ICU itakuja tusaidia baadaye.
With no time, the walls of the ICU were standing firm and the construction site was a beehive of activities, with some roofing the building, fixing the ceiling and the floor tiles.
Leo tulikuwa tunaweka tiles, pia tunaweka ceiling. Hiyo ndio ile kazi kidogo imebaki, na pia stima. Ile kazi ya kidogo na kufix maji, maybe na rangi. Kwa hivyo mimi naonelea kukifika hii wiki, siku zingine 2, mimi nitakuwa nimemaliza kazi ya ICU yote. Na mimi natarajia siku ya 20 vitanda italala hapa ndani.
It took the governor's eye to ensure that the construction works were done per excellence and as per the stipulated duration, and quality was observed too. Murang'a County Health CEC Dr. Joseph Mbai was all smiles, narrating how the ICU would be of critical essence not only in Murang'a County but in the entire country.
Hii ICU tunajenga tu kwa ajili ya kujiandaa kwa masuala ya wagonjwa wetu ambao wamekuwa wakitaabika sana kwa sababu ya kwenda Nairobi kutafuta huduma hizi.
What kind of response are we likely to dispense? And that's why we decided that we have to come up with an ICU. And this is the biggest ICU in the region. It has 2 wings, and this ICU has that 5 beds.
All the major works like welding of the windows and doors were conducted at the site, as the plastering and finishing were on high gear, an activity that gave more jobs to the locals.
Kwa sasa tunafurahi tumepata kazi kibarua, imekuwa ngumu kupata hata ajira saa hii, lakini tunashukuru saa hii tuna kazi hapa tunafanya.
On the 17th day, this building was receiving its final touches like painting. Yes, it was indeed a haste but well-supervised assignment.
Within it, there is the pediatric side, whereby we have a special unit for children or for kids, and then there will be a unit which will take care of ICU and a small unit on HDU. So it's a no-encompassing program.
At this stage, well-wishers streamed in with donations that would boost the Murang'a County government in equipping the ICU. Kakuzi Kenya Limited donated 3 ICU beds with ventilators.
Kwa sababu hii COVID kulingana na vile imekuja, saa hii hata hakuna kwenda Ulaya. Kwa hivyo ukiwa mgonjwa ni hapa hapa. Na sisi kama serikali ya Murang'a tukiongozwa na gavana wetu tunajitahidi kuhakikisha kwamba mtu akiwa mgonjwa akiwa Murang'a atatibiwa hapa hapa bila kwenda mahali popote.
The governor made a clarion call to well-wishers to partner with his government in equipping the ICU, given that equipment used in such a facility are very expensive.
Wafadhili ambao wataguzwa pia tunawaomba watusaidie. Kuna kampuni kama Del Monte, kuna kampuni za maua, na pia kuna mabenki ambao yanaoperate Murang'a, hivyo tunawaomba watusaidie.
On the 21st day, the entire construction works were over. There goes a firm, splendid and beautiful building that will soon host patients who are in need of intensive care, with oxygen pipes very well connected and the Murang'a Level 5 hospital producing its own oxygen for sustainability.
Leo ni siku ya 21, sasa tumeweka machine, na kama vile ambavyo tuliwaahidi kuanzia siku ya leo tunaweza peana hiyo huduma. Na nimesema sio huduma ya watu wa Murang'a, ni huduma ya wagonjwa. Ugonjwa hauna mpaka. Na sio ati ni ICU ya corona peke yake. Ni ICU ya wagonjwa. Corona ni ugonjwa kama ugonjwa wa moyo, kama ugonjwa wa figo, kama ugonjwa wa asma, ama ugonjwa ule mwingine. Hapa tuna vitanda 35. Na lengo letu ilikuwa tumalize huo mradi kwa siku ambazo hazizindi 21. Baada ya siku 19 tulikuwa tumemaliza huu mjengo. Na huu mjengo hatukufanya kupitia kwa wanakandarasi. Tumefanya kupitia kwa engineers wetu.
It is at this stage that Murang'a Governor Mwangi wa Iria revealed that a modern oxygen processing facility was in the offing to supplement the already produced oxygen at the health facility.
The program also has an expanded oxygen production site. We've been producing our oxygen because it's cheaper to produce oxygen than to buy, because oxygen is in the air. So you just need machines which can be able to filter, distill, so that you can have oxygen which is usable for patients. So this program also has another auxiliary program or project on the side project, whereby we're also expanding our oxygen supply, because as we pipe most of the oxygen which we produce here into the ICU, there will be need for higher demand for oxygen even in other areas. and also by the ICU.
The building was dedicated for use by the clergy of different denominations in Murang'a County, awaiting official commissioning by the President of the Republic of Kenya, His Excellency Uhuru Kenyatta, who has been on the front line in the provision of quality healthcare for all Kenyans under the Big Four agenda outlined by the national government of Kenya.
Kwa sababu huu mradi ni part of universal health, mimi tutaanza tu, lakini mambo ya kuzindua kirasmi itafanywa na Rais wa Jamhuri ya Kenya, kwa sababu huu ni mradi ambao unamhusu. Hizo pesa tumetumia ni pesa ambazo tunagawiwa na serikali kuu ya Uhuru Kenyatta. Kwa hivyo uzunduzi rasmi ningependa na ningemuomba Rais baada ya corona akifungua nchi, kwa sababu tunajua alikuwa ametuelezea atapiga safari moja katika kaunti ya Murang'a, tutamwachia nafasi, yeye ndiye atazindua rasmi.
The 34-bed capacity ICU is the biggest in Mount Kenya region and has served as a savior to many lives, especially during the third wave of coronavirus pandemic.
Being a level 5 hospital, we get referrals from our sister hospitals, the sub-county hospitals, and also from without the Murang'a County. And out of the patients that we see, every now and then, at least every week, we have like 2 patients who require critical care, and we have been having problems in having to refer them to Nairobi or to Thika. So this facility, this new critical care unit, ICU, is going to be a game changer. It's very welcome because it will enable us to give our patients who require critical care and treat them here locally. In the process of this ICU being constructed, as engineers we are doing their thing. As from the medical side, we are also doing our bit. We ensured that the equipment has been procured, and we also have ensured that our staff are trained, and in the process we have also hired new ones for the skills that we didn't have.
Usually we've done like between 5 and 10 units in quite a few hospitals. This is the first time we are undertaking such a massive work of that 5 ICU bed unit, and this is by no means a small undertaking. It's extreme, huge work, very involving. We've spent entire night doing this work, and to see to it that we are able to, the hospital is able to give the service within the shortest time possible. We've also entered into a service agreement with Murang'a County government for maintenance of this facility, such that moving forward, every so often when required to be serviced, we are the people to undertake it, so that at no single time you'll find the bed or the ICU not working.
So far, over 713 patients have been admitted in this facility, with numerous referrals from public and private hospitals across the country. The Murang'a County Government, bravo Governor Mwangi wa Iria and the proud people of Murang'a County.
Nirudishie shukrani wafanyakazi wa kaunti ya Murang'a, Engineer Amos na engineers wale wengine na wale wote, county secretary, watu wa finance, wote wamekuwa hapa, hata MCAs walikuwa hapa, tukaungana pamoja mpaka tukamaliza. Kwa hivyo hii hata sisi tumesoma kitu na tumejua hali na jinsi ya kuharakisha miradi ya maendeleo ili tuweze kuwapatia wananchi wetu huduma kwa wakati ambao unafaa.
Murang'a County, nowhere to.